All right, so this is a patient who we're seeing currently. He may be having a brain bleed and has a headache. He's had a headache that resolved and then it came back. Um, let's see.
Hi Krishna Prabhu, Dhanavad
Haribol,
Pranams.
Haribol. Okay, so we are live and
Yes, Prabhu.
okay, we're live here on Facebook. Is Rasika Gora Das?
Is he? Yes,
Haribol?
Rasika Gauradas. Haribol Rasika Gauradas.
Haribol. All right, is Srinivas Prabhu on? I guess that's the guy, the man of the hour, right?
Absolutely.
Yeah, and this is Madhu Gopal. Okay, so can you tell me a little history before our patient comes online?
Okay. Uh, should I go ahead, Prabhu, or you want Rasika Gaur Prabhu to go ahead?
Go ahead. Go ahead. Just tell me what happened.
Just to share with you, Prabhu, we, I think day before yesterday, Srinivas Hari Prabhu began to get severe headache. I think that was around 10 o'clock at night, and it was
Right.
still increasing in intensity, but there was no neurological fallout per se. Blood pressures were normal. He had a pulse of around 114. He was apyrexial. All systems technically were NAD, and based on the fact that he had
All right.
increasing headache,
So
I
my
advised
understanding
him
is
to.
the last time that I saw him, he was doing well.
Yes,
Is
absolutely.
that correct? He was doing well. He was having a headache, which
Correct.
is 3 out of 10 headache. And
Yes,
then he took the prednisone and then he was doing well. And then he
yes,
stopped. And then he had a severe headache. And then
yes.
I wasn't contacted at that time. So can you tell me what exactly happened between that time? Because I heard about
Thereafter,
this yesterday, and then I tried to get in touch with him yesterday, but he didn't come on the Zoom link. So
thereafter he went to the PSG hospital, and
uh-huh.
I think he consulted with the doctor up there, and they,
Right.
from what I was informed, he was put onto naproxen and Tramadol, which improved his
Hmm.
headache, but then he developed abdominal pain. He then went back to the
Why would they have
hospital
given him
yesterday.
tramadol? Tramadol
Uh,
is probably not the right medicine to give, um, especially and especially naproxen. Probably don't want to give an
yeah,
NSAID if you're considering an intracranial hemorrhage. And then
absolutely.
MRI is also not the first thing to go for. I understand that he wanted to go for an MRI.
Yeah, we were thinking of an MRI,
Yeah,
but
first thing to go
maybe
for
as
is a CT scan because
fine.
that takes 5 minutes, and then you can really diagnose if and it's better for an acute bleed.
Okay, well, that'll be perfect,
So
Prabhu.
so I'm sharing my screen here. This is so basically you can have um, ischemic stroke, intracranial hemorrhage as a part of this, but this is uncommon. The common thought processes are you have muscle pain, headache, altered sensorium, hyposmia, and hypoglycemia. This is on PubMed. This is by Gaurav Nepal et al. And this is sort of an article that's just available. So,
Yes, Prabhu.
and this was just published in July. So as far as neurological complications of COVID-19. So the
Right.
question that I have is I don't know what his neurological exam looks like now, but it probably would be a good idea to send him off this morning for a CT of his head. Number two,
Okay.
I wouldn't treat him with NSAIDs because
Correct.
this is, I mean, these are just the neurological complications, but we know that the kidney is hit with uh, with COVID-19 also. So treating him with NSAIDs may not be a good idea as a double whammy, even if he doesn't have an intracranial bleed.
Yeah, I fully support that, Vinay. Got it from you. Is Srinivas Prabhu there available? Hi, Krishna.
Rashika Gaur Prabhu, हाँ I think we need to connect Srinivasa Hari Prabhu. Can he be
I
reached
informed
via
him,
Zoom?
Prabhu. I informed him. So I'll just remind him once again, Prabhu, to connect.
But my doubt is if he's not accessible to Zoom, possibly what is the recommendations we heard from Vinay Prabhu, we can pass it on, or do you want to speak to him, Prabhu? If it is necessary,
Yeah, I want to
we can...
speak to him. I want to evaluate him, right?
Okay, okay. Rashika Prabhu, then please try to connect him.
Yeah, I'll just try, Prabhu. Give me a second.
Sorry, Prabhu, just give us a minute. He'll let him
No
try.
problem.
No problem.
I mean, wait.
Vinay Prabhu, just additional information. Yesterday, when Srinivasa Hari Prabhu visited the
Hospital.
hospital, and he went to visit the pulmonologist, and then he has mentioned about he was originally suspicious of some other issue, but then later on eosinophilus was on a higher scale. However, he said that's not the major cause for his headache, and then he has recommended to see the neurologist today prior to going for a scan. So that was the suggestions given by the pulmonologist yesterday. So first he has to go and see the neurologist today, and he will evaluate. And then as per his recommendation, I think that's going to be a decision whether to, as you rightly mentioned, if MRI is required or CT is required. So that has to be what do you call that, concluded after his visit to the neurologist. That was the status yesterday. Over.
Why don't we do it the opposite way? Why don't we look? We've had a headache. He got better, and now he has a severe headache.
Yeah,
he's got a severe headache. Why don't we just get the scan? Because the neurologist, Hare Krishna, is this who is this?
Hare Krishna, I am Srinivasa Haridas Prabhu.
Oh, Haribol.
Hare Krishna, Dandavat Pranam.
Haribol. Hare Krishna, Prabhu. Haribol.
How is your headache?
Headache is still there, Prabhu. It is.
Headache's still there. How bad?
Yesterday it was heavy night. After taking tablet, it was reduced. From the today morning, again slowly it is increasing.
Yeah. So, okay. Can I just show you something? This is my speculation. Can you do me a favor? Just can you look up for me? Can you look up? Look up, look down. Look to your left. Look to your right. How is your neck? Does your neck hurt? I know you said you had neck pain before, previously,
yes,
from my notes.
Correct.
But my question is that's old, right? It's not new or anything like that?
No, that neck pain is always it is there, Prabhu.
It's always there. Okay. Do you have a history of fever recently?
No, Prabhu. Only this COVID fever only. COVID time I got fever, but
okay.
After that,
so I don't think. Fever. Can you lift up your arms in the air? Good. Can you do this for me? No. Do this. Just do this.
Touch your nose, Prabhu.
Touching your nose.
Yeah.
Touching your nose.
Okay.
Okay. So this is pretty good stuff. I think you look pretty good. Can you just walk to the door? Are you steady on your feet?
1 second. Yes, Prabhu.
Are you steady on your feet?
I am standing, Prabhu. Yes.
No.
Are you steady? Do you feel steady or do you feel unsteady?
நிக்கிறப்போ வந்து உங்களுக்கு தலை சுத்துதா இல்ல செடியா நிக்க முடியுதா?
Steady, yes, I am able to stand steadily, Prabhu.
Okay, go. Okay, go ahead and sit down.
Yes, Prabhu.
Okay. So I don't think we should see any more doctors. Let's just go straight for a scan, a CT. Okay?
Oh, okay.
That's number one. We don't have to see any more doctors. Because the problem is that, well, if the doctor says no, are we not going to get the scan? No. Now the headache's gone on long enough and it's gone to severe that nothing is helping. I do have a feeling that I know what this is. I feel that COVID-19 causes headaches, and I think the mechanism that COVID-19 causes headaches is I think that virus passes through the blood-brain barrier, or inflammatory markers in the brain, like bradykinin, and all these things cause maybe some irritation in the brain, which you don't really care about. It's just these small little chemicals that are giving, but we're getting the signal that you're having this. So I want two tests. I want a CT head.
Okay.
And I want a CT angio head and neck.
Okay.
With contrast. So I'm going to write that in the group right now. So I want you to repeat it after me because I have 3 tests that I'm requesting.
Srinivasari Prabhu,
Yes,
Prabhu. He will also keep in track of what he's saying. Okay. Yes, Prabhu.
Okay. So I think this is absolutely key. You look beautiful. But I know that you're in pain. I also don't like the medicine that they gave you, because the medicine that they gave you can cause seizures. So if you've had a stroke recently, which is a brain hemorrhage, there's 2 different kinds of stroke. One is one that stops blood from going to the brain. One is too much blood is going into the brain, and it's going in the wrong places. So if you've had that, then giving you tramadol may not be the best medicine. And I think Vaishnav Pranam Prabhu and I agree. We just, in the Western hemisphere, we just don't believe in it as a great drug. Okay, here they love it here. But for some reason, I believe that a lot of people aren't neurologically trained. I was just reading a paper that in India, there's only 2,000 neurologists. So that's for 1.3 billion people. Okay, so maybe it's not as strong here as it is as other places. Okay.
That is you're talking about the naproxen, Prabhu?
Both. I don't like naproxen either. I don't like it either. I don't like naproxen. Naproxen is not as bad as of a no-no, but it's still not very good. Because if you're having bleeding in the brain, it may not be a good idea. I'd like to find out what is causing this headache. I agree, because now it's back. But I'm doubtful that this is bleeding. But still, nonetheless, we know COVID-19 can cause bleeding. So we should go for it. We should go for the CT. We should go for a CT angio head and neck. And then you should call me immediately after that. And then we can talk directly to the neurologist, whatever you'd like. If you see the neurologist and then the neurologist says, no, you don't need it, I'm going to disagree with that neurologist.
Okay. Straight,
okay, and I think
to the scan.
I would go straight to the scan.
Okay. Vinay Prabhu, can I request you one small favor? Is it possible you can share a prescription for this, so that here usually when we go to the technician, he will ask for a prescription by qualified doctor.
Yes, without prescription, they will not do this.
Yeah, I can give him a US prescription. That's no problem.
All right. Yeah, okay.
That's no problem. So we'll give him prescription. The other issue is, have you been vomiting?
No vomiting, Prabhu.
Okay. Where does it hurt most in your head?
Actually, it is here, Prabhu, both sides, and the back also pain is there. The back also.
Yeah. Okay. And we know his creatinine. What's his creatinine?
Prabhu?
Your blood test, Prabhu. Your blood test, which you did. I don't think we did a creatinine, Prabhu. I don't think we did. Urea and creatinine went done.
Okay, we didn't do creatinine. All right, hold on 1 second. Let me check. How do I get this message to you? Give me 1 second.
If you go on to WhatsApp, Prabhu.
Yesterday I have posted, Prabhu, the photo of blood test.
On WhatsApp? On WhatsApp you gave me the creatinine, or we didn't order one. Is that correct? Or wait, What was his labs recently? Did you have recent labs? You put those on?
Yeah, it's come up. He posted it on the SHD, bro. I think he put it on there.
So this is the problem is that that's why I had requested for one thing. I had requested that you guys give me the number of the actual doctors that are on the floor there, but I never got that number from anybody. And this is why, because when there's a disconnect as far as communication is concerned, this is exactly what happens, is that one doctor is going in this direction, one is going in this direction. So have I missed the number for the actual physician when I requested it, or have you guys posted it? I don't see it on the group.
No, Prabhuji, what the information Srinivasari Prabhu is telling is that Dr. Nageshwar, who is the dean, who is the key coordinator for his treatment in the PSG hospital, he's doing only the administrative coordination, whereas he's not the one directly treating Srinivasari Prabhu. And he's been going to various doctors as per the directions in different departments. So the question was, whom do we, bring in as a key contact? Or can we even request the dean, who is not the practicing doctor, but more of the administrative head? Can he be the person who can communicate with you? So
yeah, there needs to be a point contact there, right? A doctor on the ground, because for example, for Guru Maharaj, I'm the doctor on the ground right now, and then we're going to switch, and then but we switch always, and there's always one doctor, one point doctor that's on the ground, right?
Okay, so we'll discuss that with even the the dean of PSG hospital, and then we'll request him to provide us one
because that way we can all communicate, and then it doesn't become a hodgepodge, right? Sure. And everybody agrees.
Yeah.
Okay. So, all right.
Ratnakar Prabhu, I'd like to suggest that. Sorry, Vinay Prabhu. Yeah. I'd like to suggest that since the dean is facilitating all his consultations at the hospital.
Yeah,
he's also a doctor, so he has a clinical background.
Yeah,
he may be in, at the interim, let's try and make him the contact point for the communication at the hospital. That's what I would like to suggest, Prabhu. And in the event, if we need to maybe ad hoc discuss with some of the other departmental heads that are there, he can be the contact point for facilitating that discussion.
Sure, Prabhu. We'll discuss that.
Would you be? Would that be fine with you, Vinay Prabhu?
Yeah, that's absolutely fine. And then we can coordinate and we can discuss. This will just have to be just for medical legal reasons here in India. I just have to do it online here in this way, and so that way it's that way people know that what's going on, and I have a record. So the next question that I have is he's not vomiting. How are you eating? Are you eating, or did he go? Did Srinivas Prabhu go? Is he not on anymore?
Prabhu, Srinivasari Prabhu, உங்களுடைய டயட்டை பத்தி கேட்கிறாரு, எப்படி இருக்கு? Srinivasari Prabhu?
Prabhu, I think he got disconnected, Prabhu.
Oh, is it?
Okay, that's fine. So the key is that he's not vomiting, but I forgot to ask him if he's actually eating. So I think we need to know the answer to that question.
Prabhu, to answer this question, to our knowledge, yes, he's eating, and because the prasadam is being served from the temple, and so far, whatever the prasadam is supplied to him, he has been consuming that.
Okay, perfect. Okay, well, so sounds good. So I think my clinical suspicion as far as a bleed is low, but as far as going for the MRI first, if what we're looking at. So what are the things that we would be treating? Number one is we could be treating a bleed, and then we'd admit him to the hospital if he has a bleed. Number two is he could have some sort of inflammation in the back of the brain or anything like that. He doesn't have vision issues that he's complaining about right now, no blurred vision, and he's having headache on both sides. So he could have a giant cell, arteritis type situation, but that's unlikely also. So he should get the CT head, CT angio, head and neck. I'm also ordering, I'd like a ESR and a CRP, which is a sedimentation rate and CRP. And then those two things. And then the third thing he should do is just go for those tests immediately, get back to me, and then we'll decide what he wants to do. Do we need an MRI? So the third diagnosis that we'd consider is a vasculitis in a patient like him, like there's some cases of COVID associated vasculitis of COVID-19, which is inflammation of the actual arteries itself, and that would cause some sort of stroke-like picture. We'd probably see it by now on the CT scan, and then we'd get an MRI afterwards. But what would we do for situation 2 and 3? Situation 2 and 3, we'd probably treat with steroids for him. Situation 1, if he has a bleed, which is unlikely in my opinion, given his physical examination, is that we'd probably just admit him to the hospital, and then we'd wait for that bleed to resorb, but we'd certainly take him off of any naproxen, and we wouldn't want him on the tramadol either. We'd probably find another way to treat his headache. So, but that's a thought process. Now, the neurologist inpatient would be taking over at that point. But if he goes to a neurologist now, in my opinion, then we're just circling around and around and around. Okay,
got the point. Prabhu, just one more information. He has been also advised to administer Ecosprin, aspirin. So he's been taking that all.
Yeah, no. Did they put him on the Ecosprin just now?
Yeah.
No. If we're suspecting bleed, we're not putting him on aspirin.
This is what he said to me today morning. I think this is what he mentioned even to Vaishnav Prabhu. This was given to him with the suspicions that the COVID can cause blood clots. So to make his blood thinner, they have administered him Ecosprin as well.
No, I agree. He looks really good. Now, clinically, he looks really good enough to not have one. But now, since it's all, let's just get the CT. Let's get the CT, make sure that he doesn't have any sort of bleed on it, causing any irritation. And go from there.
You mentioned about to do this after a BUN. Is it another test, Prabhu? Creatinine, we can understand. What is BUN?
Okay, so BUN, so we'll get they call it LFT, KFT. We want the, I guess, let's get KFT here, which is a kidney function test. Yep, we'll get CBC. I'll put it all down. We'll get CBC, KFT, LFT, and then we'll get ESR, CRP, and then we'll get the CT angio, head and neck, and we'll get a CT. I'll write it all down.
Okay, I think we did already. The LFT was done already for him.
Oh, it was?
And we have these results already available.
I just checked. I think we've done a CBC also from.
Yeah, I think so.
Okay. Yeah. And what's the CBC showing?
It's CBC. I think I'll give it to you right now.
All right. No, you did you already did an ESR also.
Yeah.
So ESR was 5. So, okay. D-dimer was 0.23.
Yeah.
Platelet count was 300.
Yes.
Let's see. Hemoglobin, hematocrit is 13.3 over 41.3. Yeah, I'm doubtful of a bleed. But what's his white count? Let's see. White count. You can have a white count. Where's the white count? White count is 13.9. It's a little elevated. And the normal here is 4 to 10. And he's 13.9. But he's got COVID.
Yeah.
So that doesn't really tell me anything. Okay.
I was thinking at another aspect, besides COVID being a fact that he's diabetic, is there an infective process going on, like an underlying meningitis, God forbid,
Yeah,
that's at the back of my mind. I'm just sharing with you, that's at the back of my mind. Yeah. Because of that white cell count being slightly elevated, the fact that he's diabetic, that means his immunity is not functioning at 100%, but he's basically immunocompromised. So he may be sitting with an underlying meningitis.
Aseptic. So, is it worthwhile to get an LP?
Yeah, I think we may have to in time to come from after the CT break.
But if that's the case, then let's go straight to the hospital and get admitted, and then let them do everything. If you feel like he looks that, I don't know.
I mean, he's not. I don't think maybe admitted.
Pretty good.
He's looking. Yeah, he looks pretty good. He's apyrexial. Neurologically, he's definitely intact. And
I mean, then if you're suspecting meningitis, I have a lower index of suspicion. But if you are suspecting it, and we want to put it on the differential, why don't we just get him admitted and then let him go from there? Why don't we go in from the emergency room, let the neurologist inpatient see him there, and then let them order all the tests. Because now, because
That's
then,
true.
you know, because then you're going to want him on IV antibiotics, just empirically, and then go from there.
Yeah. And Ratnakar Prabhu, the
Yes, Prabhu.
CRP stands for C-reactive protein. Just in
Okay.
case, you know, the pathologists on that end, maybe they have a different terminology. I'm not sure. But
Yeah,
So
it's
should
called
we
okay.
change?
C-reactive protein.
Should we change our strategy then? If you want an LP, patient Prabhu,
Yes,
then
Prabhu.
I think if you definitely want an LP, no matter what, I think it's better than just go straight and get admitted.
Yeah, that's true.
Then don't do the test first, because then you're going outside to do the test when they have the CT scan. Just go through
Yeah.
and through the process, right?
Yeah,
But
absolutely.
you know, I was hoping we could just get away with just getting a CT head without, and then a
Mhm.
CT angio head and neck, and then seeing if he'll just get better. But this headache doesn't seem to be going away. But then also at the same time, we haven't really treated him very well for a headache either. We've just given him
Yeah.
some steroids, and then, but that's it. But it's absolutely necessary to get a head, and then if you want to get that LP, then let's not go straight for a CT. Let's let the neurologist see him as an inpatient.
Mhm. Ratnakar Prabhu, will that be possible?
Yes, Prabhu, that is definitely possible because already they have given him an appointment to see the neurologist today when he visited the pulmonologist yesterday. So that
Right.
is already on track. He has an appointment. And if he wishes to continue, go to that appointment, that's fine. So he's available. Now, the question of after his visit to him, then is he going to make a decision to admit him in the hospital, or I don't know. It's all going to be after that. Is it? We will try to see Prabhu at what time he will be able to see. But then problem is, if he want to
Well,
have a conference call,
I'm
if
saying
he's
he's
going to,
having
yeah,
he had a severe headache
yeah,
last night.
mm,
Now he has less of a headache. I'm saying go straight to the hospital, get
yeah.
admitted, allow the neurologist to come and see him there.
Mm.
Is that possible?
Generally, nowadays they don't get this admission so fast, Prabhuji. The reason is because the beds are very scarce now. So they try to minimize the admission as much as possible, unless and otherwise it's really an essential part. So they
Right.
normally go through the emergency ward, and then they make a decision, and then they come to say, okay, you can be admitted, or you can be getting treated from your home. So that's the order of the day in Coimbatore as of now. So I'm not sure if we can get him admitted straight away based on his headache. But he visited the COVID emergency ward day before yesterday with the same problem of severe headache. And they also told that time, no, we cannot admit you as of now. It's all full. And they're given some medications and then go back to your hospital and come back tomorrow morning. So that's what happened the day before yesterday. Yesterday, he visited there. They found him. Everything is other parameters are okay. So then they have recommended to go and see the pulmonologist. So that's the development. Now, pulmonologist said, my side is clear. It's not very serious. Now you have to see the neurologist. So that's the progression it has happened.
Right, and if the neurologist wants, he'll admit him.
Yeah.
I don't really want to stick a needle in his back just now, because
Yes.
if it's probably an aseptic picture, if it's an
Mm.
aseptic picture, they're going to treat him with IV fluids and let him go anyway. Do you feel like if there's a bacterial meningitis, I would feel like something else.
Mm.
That's my only thought. Okay, fine. Let him go see let him go see the neurologist on the floor on the ground. If the neurologist on the ground doesn't want him to go get a CT scan and just gives him some medications, then why don't you come back to me, and then I'll just write for the CT head, CT angio, head and neck.
Okay. And
Okay.
and it's in another 1 hour's time. He's, I think, supposed to be there with the
Oh, so
neurologist.
that's really
Yeah,
quick.
in
Okay.
maximum 1 hour, 1.5. I think basically Indian time by around 10:30 to 11, he's supposed to meet with him. So if it is okay, then if the doctor agrees, can we maybe quickly organize a meeting on call and see what he can discuss directly with the doctor if it is required? Will it be
Of
okay,
course.
Prabhu?
Yeah, of course. I'm probably going to be with some other patients too, but like I'll send off a Zoom link if you just ping me.
Okay. All right, Prabhu. I'll first,
Of
we'll
course.
first check with him. If he's willing to go for a conference meeting, then we'll do that.
Okay, sounds good.
Yeah. All right.
Yeah.
All right, great.
Prabhu, from my side, from about 11 o'clock Indian time, or was it 11? No, that'll be from about 12 o'clock Indian time till about 4 o'clock. I've got teaching that I'll be involved with.
Okay.
So anytime before that, I'm fine. But if it's between that time, between 12 and 4 Indian time,
Okay.
I may be stuck. That's my
Okay,
challenge,
Hey,
Vinay Prabhu.
please tell him not
I've
to
act-
take the aspirin this morning.
Yes.
Okay. Okay.
Okay, thank you. All right.
All right.
Yeah.
Okay.
One more thing, Vinay Prabhu. There was a
Yeah.
query from Srinivas Hari Prabhu. I've told him if he's going for the CT, if he does go for the CT, he shouldn't take. Technically, shouldn't they be on what you call this NPO, Nilpa Os?
No,
If they're
that's
going for
okay.
the
He can
CT?
go down anytime. CT head, yeah.
Can eat, right?
CT head, he can have CT head, CT
And can
angio
they?
head neck. Yeah. Tell him to eat for sure
Okay.
because we don't know when he's going
And
to get it.
okay, and he can take his insulin also, I'm sure. Am I right with that?
Yeah.
Yeah, that's fine.
Absolutely.
Okay.
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 Thanks,
All right.
Vinay
Thank
Prabhu.
you.
Thank you for your time.
Thanks.
Thank you.
No problem.
Thank you.